I'm Carol Brosgart. I'm Senior Vice President and Chief Medical Officer at Children's Hospital and Research Center, Oakland. And the hospital is dedicated to providing the highest quality of pediatric care, providing world-class medicine to any child who walks through its doors, irrespective of its ability to pay. We are also an institution that's dedicated to research to improve and advance health care for children, both primary care and specialty care. And we're a center of excellence for teaching and have one of the largest pediatric training programs, residency programs in the state and in the country. You know, we have over 250,000 outpatient visits every year. We have over 55,000 emergency room visits every year. We have over 11,000 admissions to the hospital. About 55% come from Alameda County, about 45% from Contra Costa County. And then that other 10% of kids, they come from Central California all the way up to the Oregon coast. And the reason for that is those other counties don't have, some of them don't even have public hospitals anymore, but where they do have a public hospital, whether it's a city hospital or a county hospital, a district hospital, they don't have pediatric beds. They don't have pediatric specialists. So they all come to us. We are a regional, the sort of northern central California up to Northern California regional medical center of excellence for pediatrics. Let's say a family brings a child in and the child has high blood pressure and they need to see a cardiologist, or a child has diabetes and needs to see an endocrinologist, or a child is having a seizure, epilepsy, and needs to see a neurologist, or a child has found to have a tumor or found to have leukemia, or has a complicated break of a bone, has cerebral palsy, whatever it is. If you need to see a pediatric specialist, either as an outpatient or an inpatient, you're sent over here to Children's Hospital. As you know, the economy has been going downhill for a few years, and when the economy falters, more and more people lose their jobs, more and more people lose their health insurance. And when people lose their health insurance, they become uninsured adults. There is a program for people who don't have health care. It's called Medicaid nationally. In California it's called Medi-Cal. And it's a shared program, so part of the funding comes from the feds, the federal government, and part of the funding or responsibility is a state responsibility. 2006, 4 years ago, 60% of our patients had Medi-Cal. But over the last 4 years, as the economy has tanked, the number of kids with Medi-Cal has increased. And by the end of 2009, we were up to 71%. As the proportion has gone up, you could say, well, it's great, so you don't have a lot of uninsured, but the reality is the Medi-Cal program pays very, very poorly. I mean, Medi-Cal's been generous in giving children access, but the reimbursement rates in California are so poor. What that means is that for every dollar that it costs us to care for a child, we're being reimbursed by the state at about 10 cents on the dollar. And I'm not talking about our charges. I'm talking about what it costs us. So let's say you had a child who was on Medi-Cal and you brought that child in. And let's say it cost us, you know, a few $100s to see that child in our outpatient department for a visit. We would be lucky if we got 10 cents on the dollar. We'd be lucky if we got $20. That's not going to cover the rent. It's not going to cover the staff. It's not going to cover the laboratory tests. It's not going to cover the medications that are required often to care for someone. So the way we've been affected by the state budget, it's really how are we affected by the economy, and it has to do with the proportion of children we have. If we're losing money on every child we see, whether it's an outpatient or an inpatient, back to 2006, we've been losing about $20 million a year. Over the last 4 years, we lost $80 million. Because the Medicaid or Medi-Cal reimbursement has been so low, you find city by city, county by county, doctors saying, we just can't take Medi-Cal patients. And they're closing their practice to new patients, or they're saying, we don't want to take those patients at all. Very few hospitals throughout the state are even taking care of children anymore. There are no pediatric beds at the county hospital. So if you are a child and you're brought into the emergency room at Highland, or if you're being seen in the Well Baby Clinic or the Well Child Clinic there, and you're sick, and you need to be admitted to the hospital, you cannot be admitted to Highland Hospital. There are no beds there. They're sent over to Children's Hospital. And we're looking at all kinds of ways to trim our budget, just as a family would if you lost a job. You know, instead of buying something brand name, you might buy generic. So, we're not going to buy brand name Xerox paper anymore. It's generic. But there's only so many savings you can eke out in that way. We're looking at every way that we can do things better, smarter, more efficiently. And we're also looking, can we continue to provide all of the services we provide? We don't want to limit service in any way, and there's no backup if we're not here. But we probably are going to have to do more for more with less. Cutting programs to the most fragile in our society is not the route and the method to solve our budgetary problems. And I agree that we need to be fiscally responsible and that we shouldn't waste, but we need to invest in the future, and we need to invest in today. I would tell them to invest in education, and having, when my family moved here, we were immigrants, and we moved here from Canada in 1963. My parents wanted to come here because we had a premier education system, because we had a public education system, that you could go to public school from kindergarten all the way through to professional school, and that it was as good or better than private schools. We need to reinvest in education. That's reinvesting in the future, and that makes it then attractive for businesses to be here. We need to revamp our tax code. We need to eliminate Prop 13. We need to raise Medicaid reimbursement rates. We need to invest in preventive care so that we find problems when they're small problems, not when they're major problems. And then we need to invest in healthy communities so that quality, affordable, fresh food is available in every community. We need to put recess and exercise, back into schools. We need to have schools really reflect the full spectrum of what children need. It's not just reading, writing, and arithmetic. It's exercise, it's quality food, and it's also creativity. It's, we need filmmakers, we need writers, we need musicians, this is what we need to make the world go round. The state needs to step up to the plate to take care of its most vulnerable. And you judge a society at the end of the day by how they care for the most fragile in their society and how they invest in the future. And whether it's investing in the health of children or it's investing in the education of children, that's where our budget should be focused. And it's not today.